Take the floor.
So I will show you the perspective from Germany, and it will be a very different presentation than what you have seen during the day. I'm not a scientist. I'm running a public relation campaign in Germany, marketing public relation, and I give you a short overview on what we have done so far. You know, we have an opportunistic screening program, and I guess that it is, even if it is a small success, this success is due to the energy so many people invest in Germany into the public relation of this topic. It started in 2002 when we have had almost 30 years of opportunistic screening program with FOBT, and it didn't change anything. So in 2002, my son Felix died of colorectal cancer, and we took this as an opportunity for the whole foundation to switch to colon cancer prevention. Also, it was his wish to do that. It started with this interdisciplinary conference in 2001, where everybody, all the Germans who are here today, have been on that particular conference. And we all agreed on it. We have to do something. And we started then with an advertising campaign. And at this conference, we put out a Munich declaration. Today, it's a Brussels declaration for the whole of Europe. At that time, it was the Munich declaration for a program in Germany. March 2002 saw then the first colorectal cancer awareness month. I was looking to United States, and I envied these people because they since years had done colorectal cancer awareness months, and they have a wonderful journalist called Katie Couric. She lost her husband to colorectal cancer, and then she went into TV. She ran a whole week on that, and you could see in the United States that many people took the opportunity to go to colonoscopy then. What we did, so many of our partners had own programs, and our part was to organize press conference, the advertising campaign, place the ads. Also, we had a celebrity showing a live colonoscopy in TV. So we used all the different means to bring it into action. And the result then was that in October 2002, we had the program. I mean, we don't have it organized, but at least it is paid. And so we could start to say nobody has to go and pay for his preventive colonoscopy, but doctors can provide it with a normal program. Just a glimpse on the strategies we tried to develop: communication and networking, and these are the partner groups. And from the very beginning, because my son, when he died, was 33, and we had a risk in the family, but nobody had told us about the risk, we included the young people as well, because you have to educate them. They have to look into their families, and if they have a risk, they have maybe to begin with 25, 30 years with a colonoscopy. What is this? Oh. I didn't do that. Amazing. So the objectives are clear, and what we did with the network of people, we put it. Oh, jetzt geht's nicht zurück, doch. We have really built up a huge network of partners from all fields. It's not only scientists, it's not only clinics, it's cancer institutions, but it's also companies and the health ministries. We have 16 Länder, and we have 16 health ministries. To some of them, I have better relations than to the others, and so it's a total networking what we do constantly, and some of the things we took particularly into our view, like patient-oriented information. We did a workshop on patient-oriented colonoscopy preparation because, as you all know, you do colonoscopies. That is what patients complain most about, the preparation. And we did a survey on the doctors and asking them, how much do I have to drink for preparation in your office? And the answer was between 1 liter and 6 liters. So this is not possible. I mean, and in 2004, the network was officially recognized as a charity. So then this is one of the things we are really proud of. From the very beginning, we started with our own company. We addressed a lot of the big companies in Germany and told them to include it into their normal health program for the company. And in the meantime, I think it's 60 or 80 of the big companies like BMW, Allianz, and Mercedes, and all these kind of big companies have done the screening programs and have implemented it into their regular health program for the employees. And I think that is a very good opportunity to address people, men and people who normally don't go to see a doctor. I mean, we are talking here the whole day for how to implement programs seeing doctors. There are so many people who never go to see a doctor. And when they go, the doctor won't talk to them about colon cancer prevention. Then from all the interviews from the companies coming back, we put together this brochure and sent it out to 1,500 of the big companies now. And we get a lot of feedback. Many companies are using this manual to implement screening programs. I mean, that is not an organized program. It's just that the employees get informed and get offered an FOBT. So this year we asked the family practitioners. Oh no, that was at the beginning. We asked the people if they feel well informed, and you see for colon cancer it was the lowest rate. And if you then ask the people who had answered they know about colorectal cancer, 40% said they didn't know about risk factors, and even older people didn't know that older people are at a special risk for developing colorectal cancer. So that was the beginning then for our whole campaign. And the basic principles send out clear messages. So this we stick strictly to this, like CRC is preventable, go and get screened. You will see I show you a few of the ads. And then, of course, if you do leaflets, you have to use a language that people understand, and you have to make it visually attractive. This was our first advertising campaign. You see 3 different double-page ads And you see, we already included then in 2001 the young people, and the advertising company developed a special sign. And you'll see in a minute what is besides what is written besides every round thing. And she has a grape, she has an earring, and he has a golf ball. So that is a sentence what you read in the ad. The principle is you have a wonderful situation. You have persons who obviously feel well because they don't know what is inside their body happening. And the text under says, go and get screened. Now, we changed then to celebrity advertising. And we have almost all celebrities from German TV convinced that they should support us. And the first advertising with the celebrities was like this. Everyone could have a special quotation, and the ads are placed in all magazines. I mean, our company has magazines, but in the meantime, we convinced all large media companies in Germany to place the ads, and even in German Bild-Zeitung, they place advertising. So this is read by, I think, 12 million people every day. Sounds like enormous numbers, but I'm convinced you have to go on with this campaigning if you don't have an invitation system, and I hope we'll get one, and we'll work on this. This is our new advertising campaign with the celebrities. Vladimir Klitschko, the boxer, and his alter ego is telling him he shouldn't go and see the doctor, but he's sticking to it because he ignores what his alter ego tells him. And we have the same motive then for a TV spot, and then this alter ego really talks to him. So this, you can see that somehow it works, but that people know about it doesn't mean they go and get screened. So you need some other implementations as well. But at least they see it. And that is this situation of today. You can see incidence has been increasing, and very slightly down went the mortality rate. Thank you.